Representative Tipping, if you would mind presenting this amendment.
Thank you, Madam Chair. I just want to start out by thanking for the committee for all the work they've done on this. I know there's a lot of research out there to come through to get a good handle on the issue. It was an amazing public hearing with a lot of passion, and I appreciate everyone who hung in there. I was right there in the back of the room.
I say likewise.
I also wanted to apologize. I served on this committee in the 127th, and I still don't have a treat for this committee. I know I owe you a box of chocolates. I hope that does not affect the outcome of any vote for the legislation. So the amendment in front of you, I also want to thank your analyst, Ms. Netto, for helping put ideas into language. This amendment was meant to do four things, and I'll just run through those briefly. First, I discussed this in my testimony on the bill originally to make sure that we clarify and, as necessary, broaden the medical exemption so that physicians, nurse practitioners, and physician's assistants who are the primary pediatric care providers for these children can make the decision to grant a medical exemption within their best medical judgment, within the confines of their license and scope of practice, not beholden by a legislative committee or a series of rules created without action by the legislature. So you'll see in the amendment, Section 1A, Section 1C, Section 2A, 4B, Section 3 and 4, all change the language on that particular issue. The second is to clarify that additions to the vaccine schedule that would be required under these laws would have to go through major substantive rulemaking. It would require transparency and make sure that there's a vote of the legislature. We heard a lot of concern that people may be fine with the vaccines that are currently proposed, but they don't want something slipped in the future. I agree that we should have transparency and we should have a public process. Although we can't bind the hands of any future legislature to take action on it, this would at least allow it to have a public hearing and have a vote of the legislature on the issue, if any are proposed. That is in, I think, Section 1C. Also on the note on transparency, the third point is requiring a report from the Maine CDC and Health and Human Services Department to submit a report to both the Joint Standing Committees of Education and HHS on matters concerning any new developments in the evaluation of vaccine safety and effectiveness to make sure that these committees that have jurisdiction are kept appraised of the latest science, new developments, whether at the federal level or state level. And then also in there is the ability for this committee to report out legislation in response to any of those reports. And finally, the last change is the last intentional change that I had for the amendment was to change the implementation timeline to make the effective date September 1st, 2021, which would be 2 years out. If this bill were to become law this legislative session, it would be effective date 2 years out from the effective date of this bill. 2 years is a long time, and I've had some pushback from the medical community on bumping it out that far. But I think the mission of this bill is to ensure safety of our schools, to give everyone a chance at compliance. Although going from 0 to fully in line with the current vaccine schedule wouldn't take a full 2 years, this would give any families a chance to take a delayed schedule approach if they wanted to. This would also allow for significant rulemaking from the Departments of Education and Health and Human Services to work on language and allow the 2 legislative sessions to respond before the bill becomes fully implemented. The last piece, which was not intentional, was just cleaning up language that was unallocated before. And you'll see the pieces around students with IEPs that would be also currently claim a non-medical exemption. That was in the original bill. That came out of discussions with a number of people after I originally started talking about the bill with folks. And this just puts it in a different place in the statute because it's an ongoing requirement. And it just was drafted incorrectly at the beginning. I think that's it.
Okay.
Did I miss anything?
Thank you very much, Representative. Are there questions for Representative Tipping? Great. Thank you so much.